Well, welcome. We're going to continue our medical reviews with a new specialty for this show and a new guest. So why don't we start with an introduction?
Oh, well, thank you, Al, for having me here. I'm Neil Gahani. I'm a ear, nose, and throat doctor here in Milford, and I've been here for about 3 years now. And yeah, it's been a great experience being here in the community.
Where were you before here?
So before here, I was doing my residency training in Cleveland at Case Western Reserve. So yeah, it was a great experience there. I spent about 5 years here in Cleveland. Before that, I did my college and medical school training up in Albany in New York.
So they sent you from Albany to Cleveland?
That's right, yes.
I was going to say, at least you give it to New England.
Yeah, well, I was born and raised in Long Island in New York,
okay.
And so not too far from home.
Getting closer.
Exactly, yeah, closer than Cleveland, that's for sure.
So now, ear, nose, and throat. Seems pretty obvious. You know, it's not like some of the specialties we can't figure out what you do.
Right.
But if somebody was to ask you, what do you spend most of your time doing? How would you answer that? Is it ear? Is it nose? Is it...
Well, it's actually a smattering of all three. I mean, that's one of the things that attracted me to the field, actually, when I was in medical school, is that there's such a wide variety of different things that can be done in the field of ear, nose, and throat. You know, there are certain ENT surgeons that specialize in just ear surgery, some that just specialize in nose and sinus surgery, some that specialize in just pediatric surgery and things like that. So there's a number of different fields within the generalized field of ear, nose, and throat as well. So it's a very versatile field.
So you've got, I mean, it's not like a primary care, but it's
Right.
almost a primary care of ear, nose, and throat.
Right, yeah. There's actually a large portion of what we do is in the office, and you know, taking care of patients and medically managing their ear, nose, and throat problems. And there's a fair amount of it that's in the operating room as well, but there's a nice balance, a nice mix between the two.
So how much time do you spend in surgery versus the office?
So right now I spend typically about 1 to 2 days a week in the operating room, and then the remaining time in the office per week. So, so most of my time is actually in the office, but I'd say maybe 30% of it's in the operating room.
Is that the balance you'd like to keep, or?
Yeah, it's a nice mix for me. It kind of changes, keeps the pace different every day. So.
Yeah, I mean, I know some surgeons just want to be in the OR 24/7.
That's true. That's true.
I imagine you lose some of the contact, the direct contact with the patients.
Right, and the long-term follow-up and kind of that long-term relationship that you can develop, yeah.
Now, when you do surgery, do you specialize in any sub-area, or?
Well, me personally, I kind of do a little smattering of everything, but there are certain ENTs that do just subspecialize in
you
one
hear like
portion.
ear surgeon, that's it.
Right, right. So, but I kind of do a little smattering of everything. So.
The biggest reason people come to you, would I guess sinus, or?
Yeah, actually, sinus is a very, very, very hot topic, or a very frequent issue that comes in, that patients come in with. Yeah, it's one of the biggest problems that patients have that brings them into a medical office, whether it's an ear, nose, and throat office or their primary care's office. And so it's a very, very, very big, big concern. So big issue for patients.
But what can you do? I mean, when you think of sinus infections, is there anything I can do not to get them?
Well, yeah, the simplest thing would be to do things like nasal saline sprays and even nasal saline rinses. These are things that are over the counter. where you can go to any local pharmacy and pick them up without a prescription, and it's all natural, so you don't have to worry about long-term side effects and things like that. Basically, what that does is it actually clears out the mucus, bacteria, viruses, and whatnot that may get stuck in the nose, even allergens. It can help flushing all of that out of the nose and the sinuses.
I never thought, to get a spray. I mean, I see people doing it,
Yeah.
but I always assume that's after they've had an attack or something.
Yeah.
Is this something that you would say people would do routinely?
Well, for somebody that doesn't have any problems with their sinuses, probably not. For those patients or those people that do, yes, then it would be, that's one of the additional regimens that can be done to just maintain the sinuses.
What kind of problems do you have when you say sinus problems? I guess maybe I'm lucky that up until now I haven't had any, so I don't know what they are.
Yeah, well, the typical sinus complaints would be things like headaches, particularly either in the forehead or in the cheeks, runny nose, congestion in the nose, postnasal drip. Sometimes for a severe attack, like an acute sinus infection, would be things like pain in the upper teeth, fevers, even some things like ear pain or ear throbbing and bad breath can even be associated with a sinus infection as well.
Okay, take me back for an old man. You sit there and say, okay, what causes a sinus infection? I mean, bacteria, viral?
It actually could be either one. So for example, while getting a cold, which typically could be a viral issue, that tends to cause swelling of the tissues inside the nose, and that can cause a lot of these symptoms, and as far as the pressure in the face, the runny nose, and so on. And sometimes then these things can lead to a bacterial infection as well. So it could be either or.
But now, when I think of the nose, as I'm breathing in bacteria 24/7.
That's true. That's true.
So what now all of a sudden causes the bacteria to start being an issue versus, you think about it, we're talking about trachea.
Yeah.
Okay, so I'm flooding the trachea with dirty air.
Yeah.
I mean, I hate to call the air we breathe dirty, but, from a sterility point of view, it most certainly isn't sterile.
Yeah, that's true. But the nose is designed in a way that it is able to flush out the irritants, allergens, and viruses and bacteria that we breathe on a daily basis. And that's actually what the purpose of the mucus is. But when certain times either a virus or a bacteria can set up shop in the nose and then create an infection.
But I mean, how does it change? When you think of, I get a cold. And nobody ever knows what a cold is anyway. It's just the reason to have a lot of your mother's chicken soup and complain. But what can I do? I mean, I use the nasal sprays, but I don't want to get it in the first place. Is there any precautions I can take?
Things like hand hygiene is probably the best precaution. Most of these viruses and things tend to get transmitted through contact, but also making sure you cover your cough and tell everybody else to cover their cough.
Into the elbow.
Exactly.
We've learned that. Don't cough on your hands and then shake my hand, please.
Right. So.
It's amazing when we had like Mike Newstein on, and we talk about infectious diseases.
Yeah.
When the big thing came about the flu, and then H1N1, and it was like, okay, wash your hands.
Exactly. That's the biggest precaution, right?
I mean, now what is it, Purell or the little
the sanitizers.
Seem to have taken hold because I find them all over the house, but seems like wash your hands is the biggest thing you tell people.
Right.
How about the ears? What do you find the biggest issues that you run into?
Well, the biggest thing for ears would be ear infections, particularly in the pediatric, in the children's, in the children realm. But I see a fair number of adults with ear infections that come back all the time as well. But that's probably the number one complaint with the ears, either ear infections or ear pain.
Okay, so let's take it back a step. How do I get an ear infection?
Well, yeah, that's a good question.
I mean, I can understand breathing.
Yeah.
I don't stick my hand in my ear, at least I don't know that I could.
That's true. Well, there's two different types of ear infections. There's an outer ear infection, and that's also known as a swimmer's ear, or a middle ear infection, which is an infection behind the eardrum, and that's the typical type of infection that children get. And so, as far as a swimmer's ear, the way that generally happens is that either typically it would happen with water, where water would get in the ear canal, moisten the skin of the ear canal, and then that would allow bacteria and sometimes even fungal spores to grow in the ear canal, and then that would cause an infection. Typically with those types of infections, that would lead to drainage coming out of the ear, and usually it's a foul-smelling odor that comes out of the ear, and sometimes hearing loss as well, because the ear tends to get blocked. So.
But now the body creates wax.
It does,
in the ear.
yes.
Is that similar function to the mucus in the nasal cavity, or?
Well, similar in the sense that it's has the function of trying to prevent infections from forming, and so there is either not an antibacterial type of component to the wax, but it also keeps the ear canal lubricated too, so that the canal doesn't become too dry and create too much of an itchy ear.
But now the first thing people do is stick pointed things like Q-tips up their ear to remove the wax.
That's right. And
if the wax is good, why are we removing it?
Yeah. Well, and I recommend to any patient that I see to not use Q-tips. I've seen so many patients that accidentally put the Q-tip in too far, or their elbow got bumped as they were cleaning their ears, and then it ends up penetrating through the eardrum and creating a hole in the eardrum. Exactly. Yes, it's very painful. Luckily, the vast majority of those injuries tend to just heal by themselves. But once in a while, if it doesn't heal, it would require an operation to have to repair that eardrum. So
now, if we're not supposed to use Q-tips, Q-tips seems to sell an awful lot of those little sticks.
They do, yes.
What's the logic behind it?
Well, it seems to be the perfect shape and the perfect form to clean the ear, but actually if you look on the box of Q-tips, it does not say to be, one of the uses is to clean the ears. They changed the label so that it doesn't
So it's the ultimate off-label use.
Yes, exactly.
I mean, if we look at off-label that the FDA's cracking down on everybody,
yeah.
The Q-tips for your ears are not for your ears.
No, they're not. So.
But why would people instinctively want to clear the wax out of their ears? Is it irritating?
Well, I think it's because we kind of equate having waxy ears to having dirty ears, and it's not necessarily dirty. In fact, the function of the wax is to keep the ear from getting infected. But sometimes wax can overproduce, in which case then it can cause hearing problems as well because it blocks the ear canal. So there is a fine balance between the two.
Is that really common? I mean, an overproduction of wax?
Yeah.
Really?
Yeah, there's a fair number of people that I see on a weekly or monthly basis that have just wax buildup, and that's the reason that it causes the ear plugging and hearing loss. So
every once in a while you see some commercial that they use a liquid.
Yes.
That it's supposed to be safer than sticking a sharp stick in your ear.
Yes.
Is that fact, fiction? I mean,
no, I agree with that. There are numerous over-the-counter preparations for softening wax and letting it just dribble out of the ear. There's a name brand called Debrox, but there's a whole bunch of different, a whole wide variety of products out there. The simplest solution is actually just half-strength peroxide.
Really?
Yeah, just taking peroxide and mixing it half and half with water and putting a few drops in the ear. It tends to soften the earwax. You hear a bubbling sensation
I was
in
going
the
to
ear.
say, the only thing is, I mean, Alka-Seltzer in my ear, it's going to sound like.
That's right. That's right. But it helps maintain the balance of the amount of wax in the ear, and then it just dribbles out.
Well,
Yeah.
I don't know if dribbling out of my ear, just, I'll try it, but I have to trust you to do this, because it doesn't sound like it would be something I would naturally do. So now, the swimmer's ear is really because a swimmer's in the water all the time.
Well, it doesn't always happen because of swimming. It can happen because of water getting into the ear canal when showering, or for that matter, it can even happen, getting back on the topic of wax, of trying to flush the ear with water and not properly drying it after the flushing is performed.
How do you dry your ear after?
Well, the
I
easiest...
don't want to stick a hairdress.
No, but actually, sometimes by just taking a hair dryer and not blowing it directly into the ear, but just
waving it?
Yeah, just waving it around there. That'll help dry things out. Or taking a towel and just gently dabbing it on the outer part of the canal.
Neil, I think for people like you and me, the access to a hairdryer.
Yeah.
I can't remember the last time the 6 hairs I have on my head needed a hairdryer.
That's true. That's true.
You know, have to look at the girls in the house.
Yeah,
exactly. Look at my daughters and have to borrow one there. So, if I do get swimmer's ear, the symptoms are?
So the symptoms are typically pain in the ear. That's usually the first sign of it. And it can be actually fairly exquisite pain in the ear, because the ear is a very sensitive part of the body, especially the ear canal. And so when the ear canal skin gets irritated and inflamed, it can hurt quite a bit. I've heard it described as having an ice pick jammed into the ear. That's kind of the sensation that it can potentially cause. But in addition to that, it can also cause drainage out of the ear. And usually it's a fairly foul-smelling drainage because it's an infected fluid.
It's an immunological response, though, right?
Right.
You've got an infection, and the body is trying to ward it off.
Trying to clear it out, right.
Okay.
And then the third typical symptom would be blockage of the ear, which may cause hearing loss. So feeling like the hearing is down in that ear, or the hearing it may be muffled.
And antibiotic treatment? How do you treat an outer ear infection?
So the treatment is actually, there's multiple things to do. One would be to clear the ear out, and that's what I do in the office, is taking a look in the ear and physically taking a vacuum and clearing out all of the, the junk, the bacteria, the, fluid and whatever that's in there, clearing it all physically out. Another treatment would be antibiotic drop or an antifungal drop, depending on what it is that's causing the infection. If it's a severe enough ear infection, then yes, doing oral antibiotics would be necessary. But typically we try to avoid oral antibiotics if we don't need it. So that's why doing the antibiotic drops is the better way to go.
Does it become systemic, or does it stay localized?
It usually stays localized to the ear canal itself. But if the infection has been going on for long enough, or for that matter, if the person who has the infection has problems with their immune system, so for example, having diabetes or having any other diseases that can cause the immune system to not function as well as it should, it can get worse. It can become a more deeper-seated infection. So that's why it's very important that if that is happening, that it's treated right away and monitored.
So now we move down the canal.
That's right.
How do I get behind the eardrum? I thought it was all sealed.
It should be sealed. If there are any injuries to the eardrum or whatnot, then yes, there could be a hole in the eardrum. I've usually having a hole in the eardrum can happen after having some type of surgery. So for example, an ear tube, having an injury to the ear, so like the Q-tip to the ear. But there's a variety of reasons that people can develop a hole in the eardrum. And if that were to happen, then again, if it heals up on its own, then we kind of let the body heal itself. But if not, then it may require an operation to patch up and to seal.
Wouldn't I know I've got a hole in my ear, or would I know?
Not necessarily. If the hole is small enough, then it may not affect the hearing, and you may not know the difference. But if the hole is large enough, it definitely can affect hearing.
So now, if the bacteria gets behind,
Right.
what nasty little activities are they involved with there?
Well, it can cause an infection of the space behind the eardrum. That's called the middle ear space. Or it can actually cause an infection of another space that's connected to the middle ear called the mastoid. The mastoid is actually similar to the sinuses of the nose. So just like we have sinuses in the face, we have a space of air cells that are behind the ear called the mastoid. And that can potentially get infected if the fluid and bacteria gets trapped behind the eardrum.
So now, you mentioned it's mainly pediatric, but you do get some old people. You hear
Not
about
old people, adults.
adults. I'm an old person, I don't mind admitting it, but you hear about these children, and you touch wood, thank God I didn't have to go through it with my daughters, that just have chronic ear infections.
Right.
Why?
Yeah. Now, the reason that typically happens is because everybody is born with eustachian tubes. That's the connection between the ear and the back of the nose. That's actually the reason why we're able to pop our ears, particularly when going in airplanes and things like that. So in adults, the eustachian tube is typically at around a 45-degree angle, so gravity tends to work with us. In young children and infants, it's actually more horizontal. And so the actual function of the eustachian tube, the opening and closing action of it, can potentially be a little bit hampered. And so if the eustachian tube isn't functioning properly, then that can lead to a negative pressure that gets built up behind the eardrum. Then that negative pressure leads to fluid development, which then can get infected and lead to these infections that occur over and over again.
So you're going to be sucking in air that's by definition contaminated.
Well, this isn't, so it's not sucking in air from the outer, the
Not
outside
from the
world.
nose, or
It's typically, there's theories that bacteria can get sucked in through that eustachian tube and then create the infection. Yeah, but a lot of times it can even be viral. That the fluid can develop in the behind the eardrum, and then there could be a viral infection that forms as well.
where did that come from?
So these are different theories based on tests that have been done to test the fluid for
Sure.
bacteria versus viruses, and they've found actually it
They
could
found
be either
viral
one. Yeah.
contaminants in the fluid.
Yeah. So, but vast majority of these are due to bacteria. There's 3 different bacteria that tend to cause it most frequently, but then there's a wide variety of other bacteria that can cause it as well.
So now you hear about these poor kids who have to have tubes put in.
Right.
What's that about?
Well, the purpose of the tube is to act like an artificial eustachian tube.
Like an artificial drain.
Exactly. So instead of relying on the natural eustachian tube, so the natural connection between the ear and the nose, it's relying on an artificial connection between the middle ear space, so the space behind the eardrum, to the outside world through the ear canal. And so it's a very tiny plastic tube that gets put in, and it's about maybe 2 to 3 millimeters in diameter. So it's very, very small, and that allows for the pressure to equalize on both sides of the eardrum. It was actually originally designed for the military, where you would have pilots that would be going on these different flights and dropping in altitude very quickly, and their eardrums would burst. And so by putting in these tubes, it would prevent that from happening, because it allows the pressures to equalize right away. And then one day that became translated into use in the general population.
But now, it just seems, and again, I'm naive on this, but I've got a middle ear space that I don't want to be contaminated. So now I'm going to hook up an open tube to the ear canal, and I mean, isn't that a welcome sign for the bacteria to swim up the tube?
That's true, and actually that used to be a big topic of discussion where after putting in tubes, a lot of ENTs would tell their patients that they absolutely shouldn't get any water in their ears
Right.
and not go swimming and all these kind of things. There's actually been studies that were done that showed that even after going swimming, that the water pressure isn't large enough to penetrate through the tube to get to behind the tube.
So the surface tension isn't.
Right. The surface tension, it just isn't great enough. Now, deeper waters, yes, will have enough pressure to do that. But swimming on the surface
It's
of
like
the
they
water,
tell me my watch can go down to whatever it is, 200 feet.
right, and not have
And
any problems.
And I'm like, yeah, maybe the watch can. The old man wearing it, no, I'm not going down that low.
right.
But in normal swimming, I mean, when you think about it, how low do we normally go? 4 feet, 5 feet? The
Right.
deep end of the pool when we want to act manly,
Yeah.
8 feet.
Yeah, exactly.
It shouldn't be
So-
that much of a pressure.
Yeah, so the recommendation is that anything beyond 4 to 6 feet, that's when wearing an earplug would be advised if somebody has an ear tube.
So now we have specialists, ENT specialists, that specialize in ear surgery.
Right.
What are they doing that keeps them busy?
Well, there's a wide variety of larger issues that can occur with the ear, other than just in the average infection. Well, starting with infections, there's people that even after having tubes continue to have more and more and more infections, and the reason for that is likely because the space behind the ear, the mastoid that we were talking about earlier, may be infected and may continue to be infected. In those cases, in those patients, they may require a bigger operation called a mastoidectomy. That's essentially similar to opening up the sinuses of the nose. That's the equivalent of opening up that mastoid of the ear. That's one of the potential additional things that can be done.
Well, when you say open it up, if you're making a bigger hole,
Yeah.
isn't that just a bigger entryway for more infection?
Well, so what I mean by that is that instead of having a large network of little tiny cells, it makes it into one big cavity of cells. So it prevents each individual one from getting infected, and that way there's a big space for...
So you're just blowing out the walls in the house, but the doorway stays the same.
Exactly,
Okay.
exactly.
That makes more sense.
So, but that's one potential issue. But then there's a wide variety of other things. The hearing bones can run into issues as far as either being not formed correctly or over time getting destroyed by various pathology, various things. There's an issue called cholesteatoma, which is really a fancy term for skin that gets trapped behind the eardrum. And you think that that's not a big deal, but the problem is that when skin has to shed, and so when it gets trapped in a small confined space and it can't shed, it creates a little pocket, and the pocket just keeps shedding and getting bigger and bigger and bigger, and eventually that ends up eating into the hearing bones. It can eat into all of the surrounding structures of the ear, so that needs to be removed.
So it's like a foreign body response?
Similar. I mean, it can cause, it can be one of the reasons for chronic infections as well, but a lot of times chronic infections can lead to this problem as well. So it can be kind of either or. Then there are things like that are much more rare, things like tumors of the ear, and tumors of the nerve that connects the ear to the brain and things like that. So there's a wide variety of different various things that can happen.
You're too young, but as you get to my age and you get older, my darling bride always accuses me of losing my hearing because the volume at which I enjoy listening to my music, there is just something not right about like an Aerosmith or an AC/DC on low. But she accuses me as I get older of losing my hearing. What is behind that? I mean, are people losing their hearing just due to age? Is it, as our parents said, that we listen to our terrible rock and roll music too loud as kids?
Yeah, that's a great question. Hearing loss, that type of hearing loss, can happen for a wide variety of reasons. That's called a nerve type hearing loss or a sensory neural hearing loss. The most common, by far, the most common reason to develop that is exactly what you were talking about, just hearing loss over time of age, and that's called presbycusis.
That's just the parts wearing out.
Exactly.
I've got my car. It was a lot nicer at 20,000 miles than 180,000.
Right. And so over time, things can not function as well as they did years ago, and that's really the most common reason for hearing loss over time. And typically, the best treatment for that is a hearing aid. I actually gave a talk at the senior center, and there were so many folks there that didn't realize that they actually maybe are candidates for hearing aids. They just kind of lived with their hearing loss, and it can be isolating. If you're in a conversation and you can't hear, the person next to you or you're the person across the table from you, you kind of feel a little bit, isolated from the conversation, and it's definitely a large quality of life issue. So.
But now, in the old days, you had basically headphones.
Yes.
It looked like a set of Bose headphones. I'm being facetious, but they were pretty large, hanging over the ear, and it was like a sign that announced, I'm getting old. So, a lot of people, and you can say out of vanity or whatever the reason,
right,
didn't really want to carry around reminders.
Yeah.
But it seems like today's hearing aids are pretty small and inconspicuous.
Yeah, hearing aid technology has changed quite a bit over the course of the last, 15, 20 years, and beyond that even, since the first hearing aids that required wearing a box.
Right.
And wearing, a necklace with a box stuck to it, and
But
that
again,
kind of
when I
thing.
think about it, if the alternative is being deaf, or, to some degree, maybe the box wasn't that terrible. At my age, vanity goes away, It's like, yes, I want to be thin, young, and have hair. I look in the mirror, there's a fat old bald man looking at me saying, nah, not so much. But realistically, today, what is the state of the art in hearing aids?
Well, there's a wide variety of hearing aids as well. Just like you can have the introduction, the intro model car versus the mid-level and the Cadillac of cars. Hearing aids are no different. They have few different styles, options, and features that come with them.
What do I get to buy one that says only give me good news? Filter out bad news. I'll pay for the. What options do you really have on a hearing aid?
Well. So the essential components of the hearing aid in all the different models are the same. It's a microphone, so that brings the sound from the environment in, a processor that processes all that sound technology, and then also ends up amplifying or sending the information to the amplifier, which will then amplify the different sounds according to each individual person's hearing loss. And then there's a speaker that
broadcasts
broadcasts into the ear. So that's kind of the basic premise of a hearing aid. And then as far as the specifics, the hearing aid itself can be adjusted specific to each person's type of hearing loss or the amount of hearing loss that's there. And there's different features that are available. There's even things like Bluetooth or even an app on a phone that can be connected to the hearing aid and so on. So there's a lot of different
Wait a minute, I'm going to have an app to listen to my darling bride?
Well,
the only can I hit mute? No, again.
Well, no. So that's the different controls as far as turning up the volume of the hearing aid, turning down the volume of the hearing aid, changing the environment that you're in. So, for example, the hearing aid settings can be adjusted from being in a room one-on-one like this versus being in a crowded room versus being on the telephone. So things like that.
So the ambient noise can be filtered out?
To a certain degree, yes. Now keep in mind it is a hearing aid, and so it's not going to make the hearing like it was 50 years ago. So unfortunately, it's not as good as natural hearing, but it does
The
help.
rest of my body isn't either. I mean, I'm playing hockey with 18-year-olds, and I'm looking at my knees saying, you should be catching them. And, no, those body parts, the knees, the legs just don't work like they did.
So it's not, it's not a replacement for, natural hearing, but it definitely can help in the appropriate person.
Now, if somebody was selecting a hearing aid, and you're saying there's, the Kmart version and the Bloomingdale's version, what are the basic questions you would ask somebody to select the right hearing aid?
Well, as far as the style of hearing aid, there's the type of hearing aid that the main processor fits behind the ear, and then it sends a little wire that goes into the ear canal itself, and that's what transmits the sound. So that's one different style. And there's a style called in the ear, which is the hearing aid that goes actually in the ear canal. And then there's an even smaller one that goes even further into the ear canal. So there's different sizes of the hearing aids. As far as which hearing aid is best for each person, it's individualized. So for example, a person that has arthritis of the fingers and can't really reach their ear and be able to pull that little tiny processor out of their ear canal.
Okay.
They may do better with one on the outside that they can easily pull out and clean and change the batteries or whatever they need to do and then put it back in. So there's that's a consideration. Another consideration is the actual type of hearing loss. So certain types of hearing loss may do better with certain style hearing aids versus others. As far as the ranges of hearing loss. So
is there a big difference in price on them, or?
There is, and there's many different places to be able to get a hearing aid, whether it's from Beltone, from Miracle Ear, from any of the ENT offices. So, for example, in our office, we do provide hearing aids as well, or for that matter, in any audiology office here in town or anywhere else. There are different price ranges, different price points for the hearing aids, and it's really dependent upon the office, but also it's dependent upon the different features that are included in the hearing aid.
But is it like, when I go to get my glasses, I can go to Glasses or Us or some discount place, and I'll probably save a little bit of money versus going to the person who's taking care of me all these years. And if everything goes well, I'm probably paying a little bit more that I don't have to. But the day something went wrong, I'll never forget when one of the children in the neighborhood threw a rock and my daughter decided to catch it right below her eye.
Oh, gosh.
There is no amount of money that I can imagine I would want to save where I could call, Greater Milford, I could call Ron Ferrucci and say, I have a problem. I mean, with hearing aid, is it the same where if everything's perfect, you can get it anywhere, but the day that you need some help, you're better off staying with your ENT, or?
Well, there's different opinions about that, and so, but some people feel, or some people feel staying with a doctor's office is the best way to go. Others feel that going to an audiologist's office is fine. The bottom line that I tell patients is go where you feel comfortable. Go where you feel comfortable with the people that are going to be taking care of you, helping you to select the correct device for your individual needs.
Sure.
And go where they're going to be responsive to issues like that, and most hearing aid dealers are fairly responsive to that, and most doctors' offices are fairly responsive as well.
The audiologists, do they have those little MD initials after their name?
They don't, but they are actually doctors of audiology.
Oh, okay.
Yeah.
Because that's the worry is, did I go study at Okemukee Junior College? I don't know. It's scary when, your health.
Yeah, and no, that's absolutely good point. You always want to make sure that the person that's treating you is well qualified and did go through the appropriate training. Most audiologists these days are, go through training to become a doctor of audiology versus an audiology technician. So there's different levels of within the realm of audiology.
So now, I just moved to Milford, and we've gone through with every physician that's come here. How do I pick my OBGYN? How do I pick my primary care? Besides talking to the people on the side of the soccer field, which to me at least is better than going on the internet. I'm still amazed that people pick physicians on the internet.
That's true.
It seems like the great filtering system is all the moms and dads on the sides of the soccer fields asking neighbors and friends.
Right.
But how would I pick an ENT?
Well, the best way to pick one is really what you've already said, is by word of mouth. Talking with somebody that's had either a similar problem and who they went to and their experience. And actually for patients that I end up referring that have more advanced problems that I end up referring either into Boston or whatnot, the way I decide on where to send them is really based on the feedback that previous patients have given me. So, when I have previous patients that told me, thank you, Dr. Gehani, for sending me to Dr. So-and-so, I keep that person and that physician in mind next time when I have a similar patient in a similar situation. So, definitely word of mouth is probably the number one thing that should drive you in terms of how to pick a doctor.
Now, go ahead.
But the other thing I was going to say is a primary care physician's reference as well is a good place to start. So
But now I've gotten a couple names. You said, talk to this Dr. Gehani and Dr. Smith. Okay. Now do I go to the internet and look up your background? I mean, what would you do if you had to pick a different specialty, that you don't know anybody, and now it's your child or your spouse?
Yeah.
Okay, I got two names, Gehani and Smith. How do I pick which one I want to trust?
Well, yeah, in that scenario, I would talk with my primary care physician and ask them what experience they've had with different specialists within the community.
But are there any levels of training or residency, any specialty training that I should look for?
Well, every ENT doctor that is board certified has to go through a rigorous medical school residency training as well as a rigorous testing in order to get that board certification. And so there are very high standards that are maintained in order to get that distinction. And pretty much any ENT doctor that you see has to go through that.
So is it safe that if I look at ENT docs, they're board certified? You said any board certified.
Right.
Are there any that aren't?
Well, that would be definitely a factor to look for.
I was going to say, to me, if you're saying that all the good ones are board certified, or the majority, you can never make a broad brush, but so if I don't see board certified, Dr. Smith just kind of fell 2 points behind.
Well, that is definitely something to look for. But again, that's just giving that added security that the doctor has gone through all the appropriate training as a resident, but also maybe even as a fellow if they did more training for fellowship. But then also went through that testing to confirm that, yes, not only did they go through the training, but they also retained the appropriate knowledge in order to get to being able to practice.
And I can imagine that if I have some of the rare instances that you mentioned, it would make me feel better if I saw some residency or fellowship in that specific area.
Yeah, absolutely. Absolutely.
But now, would I normally... it seems like there's 3 layers we're talking about. I go to my primary care. If there's something that he or she sees, she refers me to you, And then if it's something very, very rare, you refer me to a special list of specialists.
Well, that's, yeah, if it's a problem that is a very specific issue that is something out of the realm of what I would be able to treat, then yes, then I would go to the next step and refer.
But do most people get to you through the primary care physicians, or if I know I have a sinus problem? I guess it depends on my insurance, right? Do they let me go direct to you, or do I have to get a referral?
Yeah, that's true. I mean, certain insurances require having a referral specifically from a primary care physician in order to see a specialist. But other insurances allow direct, direct appointments and no need for a referral. But the vast majority of the patients that I see tend to go through their primary care doctor first, and then decide with their primary care doctor if they want to go the next step to see an ear, nose, and throat doctor.
And then once the treatment is sort of behind you and the post-treatment monitoring, you send them back?
Yeah, depending on how the comfort level of the patient, and I always have a discussion with my patients before sending them back to their primary care doctor that, if they feel like their problem is appropriately solved, then they can continue to just monitor their issues and then give me a call if things get worse again. If they feel more comfortable following up with me, I have no problem with that. But otherwise, I would just refer them back to their primary care doctor for their normal, annual visits and things along that line.
It would seem like we spend all the time on ear, nose, but there's still that T part.
That's right.
It's just intuitive that, okay, we deal with ear issues, we deal with nose, but what kind of throat issues do you have to deal with?
Well, so the number one throat issue would be sore throats or strep throats. So that's, again, a problem that is very common in children, but it is also an issue that can happen in adults as well. The third most common surgery that kids have is actually tonsillectomy, so removal of the tonsils. The first most common is actually ear tubes. So we have the top one and the most frequent and the third most frequent operations within the realm of ENT for children. So throat infections and tonsil infections are definitely a large part of what we do as well.
So why do I let you take my tonsils out? I just have this aversion to anybody taking sharp objects and removing parts of my body.
Yes, that's true. And years ago, the teaching was to take everyone's tonsils out.
It's like an appendix.
Exactly. So if one child in the family had strep throat, all the children in the family got their tonsils removed at the same time. The teaching has definitely swung away from that, and the reason is because it's been found that was just too extreme. It was too excessive, and there was a lot of surgery that was being done unnecessarily. So now the teaching is that there's fairly strict criteria that we look for to see if somebody's a candidate for having it done.
For the people who don't understand, somewhere on the great design, somebody decided humans should have tonsils. I mean, okay, there was a mulligan on the appendix. We've never figured out why the appendix is there, at least I haven't. Yeah. So, give the great designer a mulligan. What's with the tonsils? Why are they there?
Well, the tonsils are they're part of the lymphatic system. So that's the same type of tissue that the lymph nodes have. And so it's not uncommon that the tonsils can shrink and swell when there's an infection or a virus or cold or things like that. But that being said, it's a redundant part of the immune system or the lymphatic system. So by removing the tonsils, it doesn't significantly impact your ability to fight off infections and things like that. The reason to potentially or one of the reasons to
why are you picking on the poor tonsils then?
Right. Well, one of the reasons to potentially remove it would be if the tonsils keep trapping a whole bunch of bacteria and keep getting reinfected. In those cases, it's more detrimental to keep the tonsils in there than to remove them. The general criteria would be somebody that has 7 or more infections in 1 year, 5 infections every year consistently for 2 years.
Holy moly.
Or 3 infections every year for 3 consecutive years.
Now, wait a minute. If I get an infection, how long is the treatment?
So typically it's about a week to 10 days of antibiotics.
So you're talking about 7 to 12 weeks out of 52 of infection.
That's if it's just within 1 year, yeah. Wow. And surprisingly, there are a lot of people out there that fall into that category. But more people fall into the other 2 categories of either 5 infections every year for 2 consecutive years, or 3 infections every year for 3 consecutive years. So that's just a general, kind of a broad category.
Infections, I guess the tonsils. Yes, goodbye.
Exactly.
I can deal without them.
Exactly. But with all of these criteria, there's little caveats to it. So, for example, somebody that has a lot of allergies to antibiotics, so that limits what they can be treated with. And so in that scenario, you would consider doing the surgery sooner than later. Another example would be somebody that severely has a very hard time every time they have an infection. So, for example, somebody that needs to go to the hospital and be admitted with, for IV antibiotics, for every infection. That's obviously a horrible way to live life, and so, in those people, you would consider doing the surgery sooner than later, and not wait for the full numbers to hit.
So now we move on to the dreaded word strep.
That's right. Yeah.
I mean, the thing that you immediately got parental, reaction. What is strep throat?
Well, it's a bacteria called Streptococcus, which can infect the throat and the tonsils, and then cause the infection, pain, difficulty swallowing, that kind of thing. And it can even cause things like pus pockets to form in the back of the throat. And if that were to happen, that would require doing some type of procedure to drain it.
So besides telling my children, don't eat strep, find the strep, don't eat it. Don't ingest it. I mean, how do they get strep?
Well, kind of similar to what we were talking about in the beginning.
Wash your hands again?
Wash your hands. Yeah. I mean, it tends to, the reason it kind of goes around within classrooms in schools, it can be transferred from, one child to the other at home, in daycare, things like that.
Well, the schools were always the great incubator.
That's
I mean, if you think about it, when we were sending my daughters, it's like, okay, she's going to the incubator. Let's see what she brings home now.
Right.
Because especially the children,
yeah,
they're so tactile. They want to touch.
Right. Right.
I just can't imagine. But now, realistically, there's really nothing you can do with strep except treat it, right?
Yeah. 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 I mean, when it happens, it needs to be treated. There are certain people out there that are carriers, meaning that every time they get their throat swabbed, whether they're having symptoms or not, it comes out to be positive for strep.
Is that truly strep, or is it a false positive?
Well, it can come back as positive for that strep bacteria. Yeah.
So people can maintain a low level of strep, and just their immune system,
it just tolerates it. Yeah, and the strep doesn't get to the point where it causes an infection.
Yeah, but they could be typhoid Mary again. I mean, if they're carrying even a low level of strep,
then they can transmit it to other people.
Other people, they may not be affected, but
yeah. Or it can also cause it's always there at a certain degree, but then it can spike where it can cause, certain episodes. And then the episode is treated, the symptoms go away, but the strep test is still positive. So that kind of creates a little bit of a dilemma as far as, do we do the surgery or not? And that's kind of been case-by-case thing.
Any other throat issues that you face routinely?
Other things would be things voice-related, so with the vocal cords. So any problems with hoarseness, or even things like, oddly enough, acid reflux. I've seen so many patients that are so astonished when I tell them that their voice issues or their throat issues very well could be acid reflux related. There's a lot of studies out there that have shown that that acid that can actually go up the esophagus into the throat, and it may not actually cause problems like heartburn, the classic burning pain here in the chest, but it can cause things in the throat. So symptoms such as feeling like there's something stuck in the throat, having the voice be a little bit raspy or a little bit off, even sometimes having a little tightness in the throat, or even having like a sharp feeling every time.
But wouldn't you feel the esophageal irritation first?
So that was the reason why this was such a difficult concept to grasp, but not always. Not always. I see a very large number of patients that come in with problems such as feeling like something is caught in their throat, and it turns out that after doing a short course of some acid-reducing treatments and also diet modifications, it seems to clear up the problem.
Is it a valve issue or?
Well, there are two valves in the esophagus, the lower valve here, the lower esophageal sphincter, and then the upper one. The upper esophageal sphincter is right behind the area where the vocal cord is.
Right.
So the back of the throat actually splits right by where the voice box is into the airway, so that goes into the lungs, and then the other side is the esophagus.
Well, that's the old, something went down the wrong pipe.
Exactly.
All of a sudden I'm throwing water down my trachea and saying, I'm not really up for this water thing.
Yeah, you definitely don't want that to happen, so.
Okay.
Yeah.
Closing words for people who have ENT issues.
Well, I definitely would encourage anybody that has any type of ear, nose, and throat problem to, at least bring that up to their primary care physician, and then decide with their primary care physician if it requires having a referral to see a specialist, like me. It's something that to keep on top of and to prevent problems down the road.
And as always, I think education and discussion are probably what we're learning in all these shows are the best course of treatment for any patient to self-administer. When you hear about the flu, Dr. Newstein came on, he said, wash your hands. Here we go again for infections. Wash your hands. But I think more than anything, if you have symptoms, talk to your primary care physician. Don't sit back, because issues don't just go away. And as always, we're so fortunate to have the medical center here. What Uncle Frank and Uncle Phil have brought to Milford is just amazing compared to the Little Red Hospital that we grew up in. So, as always, to our 6 loyal viewers, may God bless, and may tomorrow be a better night than tonight. And thank you for being in Milford and helping out.
And thank you. Thank you for having me here on the show.
Not too long since